Good morning, Zaraja.
Good morning, mom.
We ready to start our topic?
Yes, mom, I am also.
My subject is related to Midwifery-2. Unit 1 Terminologies related to labor.
I am also questioning you and call an answer.
Yeah. Okay.
Define obstetric.
Obstetric is the field of study concentrated of pregnancy, children and the postpartum period.
Define intrapartum.
Intrapartum means occurring during childbirth.
Define natal.
Natal relating to birth of the babies.
Define perinatal.
Perinatal means around the time of birth.
Define gravida.
Gravida means the total number of pregnancy.
Define multigravida.
Multigravida means a woman who has been pregnant 2 or more times.
Define nulligravida.
Nulligravida means a woman who is not currently pregnant and has never been pregnant.
Define primigravida.
Primigravida means a woman who is pregnant for the first time.
Define para.
Para means the state of a woman who has given birth to a baby at after the age of viability.
Define nullipara.
Nullipara means a woman who has not carried a pregnancy to the point of viability.
Define primipara.
Primipara means a woman who has been given birth once.
Define multipara.
Multipara is a woman who has been given birth more than once.
Define grand multipara.
A grand multipara is a woman who has already delivered 5 or more infants who have achieved a gestational age of 22 weeks or more. You are happy with.
Define labor.
Labor is defined as the process by which the fetus, placenta and membranes are expelled through the birth canal.
Define true labor.
True labor is defined as the rhythmic and regular uterine conditions that is accompanied by cervical effacement and dilatation and usually associated with pelvic pressure, an increase in vaginal discharge, bloody show and possibly rupture of membranes.
Define false labor.
False labor is defined as uterine contractions that are not accompanied by cervical effacement and dilatation. Contractions often irregular and cease spontaneously after a few hours.
Define normal labor.
Normal labor is also known as eutocha. It is defined as one in which the fetus presents by the vertex, labor starts spontaneously at term 38-42 weeks, and terminates naturally without artificial aid and complications to mother and baby.
Define abnormal labor.
Abnormal labor is also known as dystocia. Any deviation from the definition of normal labor is called abnormal labor.
Define precipitate labor.
Precipitate labor is defined as labor which progress unusually quickly.
Define preterm labor.
Preterm labor is defined as labor when begins before the 37th completed week of gestation from the first day of the last menstrual period.
Define prolonged labor.
Prolonged labor is defined as labor which exceeds 12 hours.
Define gestational age.
Gestational age defined as the number of completed weeks of fetal development calculated from the first day of the last menstrual period.
Define multiple pregnancies.
Multiple pregnancies is defined as the pregnancy of more than one fetus, such as in the case of twins or greater multiples. Delivery is the expulsion of a viable fetus out of the womb. It is not synonymous with labor. It is divided into 2 ways, vaginal or cesarean.
Define fetal lie.
Fetal lie is defined as the lie of the fetus is the relationship between the long axis of the fetus to the long axis of the maternal spine or maternal centralized uterus. The most common lie being longitudinal, 99.5%. The lie is longitudinal owing to the ovoid shape of the uterus. The lie also may be longitudinal, transverse and oblique.
Define attitude.
Attitude is the relationship of the different parts of the fetus to one another is called the attitude of the fetus. The attitude is said to be one flexion, deflection, or extension.
Define presentation.
The part of fetus which occupies the lower pole of the uterus and which presents at the pelvic brim is called the presentation of the fetus.
Define presenting part.
The presenting part is defined as the part of the presentation, which overlies the internal os and is felt by the examining finger through the cervix opening. Thus, In cephalic presentation, the presenting part may be vertex, common, brow, or face, depending upon the degree of flexion of the head.
Different denominator.
Denominator is an arbitrary binary fixed point on the presenting part, which comes to the various quadrants of the maternal pelvis. The following are the denominator of the different presentation: occiput in vertex presentation, chin in face presentation, frontal eminence in brow presentation, sacrum in breech presentation, acromion in shoulder presentation.
Different position.
Position is the relationship of the denominator to the different quadrants of the pelvis. The pelvis is divided into equal segments of 45 degrees to place the denominator in each segment. Thus there are 8 positions with each presenting part.
Different engagement.
Engagement is defined as when the greatest horizontal plane, the biparietal, has passed the plane of the pelvic brim, the head is said to be engaged. In most instances, the occiput is at the level of the ischial spine's O station. The assessment of the engagement of the fetal head is made on abdominal palpation and by vaginal examination.
Different station.
Station refers to the relationship of the presenting part to an imaginary line drawn between the ischial spines of the maternal pelvis. The station is said to be O if the presenting part is at the level of the spines. It is stated in signs when above and plus signs when below the ischial spines is expressed in centimeters.
Different molding.
Molding means the extent of overlapping of the fetal skull bone.
Different suture.
A suture is a type of fibrous joint that is only found in skull. Thanks for visit my session.
It is my pleasure, Mom.